You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic. We've had him on the program before, Dr. Gasser. Dr. Gasser, welcome to the program.
Welcome
back,
having me.
I should say.
It's great to be here. Thank
you. Before we get into today's topic, because people know you as Arizona's first choice for dental implants. That's about 90% of your focus? I mean, that's mostly what you do?
Absolutely. I first started working with dental implants 25 years ago. It's hard to believe.
Really? Okay.
25 years ago. But service in the Valley of the Sun for 18 years and have been focused in implants, which is a major commitment. It's a commitment of time, energy, and money to become focused on dental implants. 90% of what we do in today's practice is dental implant oriented.
You love it, though. You say
it's the best part of
dentistry.
It's so much fun because
Why?
the effect that you have on people, the effect that you have that changes their lives in a way that's hard to describe sometimes. And I'm going to show you some examples later on. But that's the fun part, and it's a challenging, growing field that's always changing. The technology, things about it are just wonderful.
You know, I had a dentist, and I told you, and he said, Randy, once I got into implant dentistry, it was addictive.
Yes. Yeah.
I mean, do you feel that way too?
I do. What's addictive is the response that you get from patients. We've been reviewing perhaps dozens and dozens of testimonials that we've reviewed from our patients over the years. And there's a theme in each one of them, and one of the things that they always talk about are the outcomes and how it has changed their life personally, professionally, how it's affected their family and every part of their life. And that's really the fun part. That's the addictive part, the fact that we can go to work and make a difference in your life today. And that makes
When it's all done, what's the common theme there? What do they say? What are they thankful about? What do they like?
They're really thankful, first of all, the function they have, the ability to simply enjoy the simple pleasures of life, to eat well, to be comfortable, to smile more. They're more confident, Randy. They're more successful in their business. Many of my clients are professionals. They're business people that are on the front lines of society on a regular basis. And so they bring more energy. You can see it in their photos. You can see it in their testimonials and their witness to us at how it has changed their lives completely.
So is your take is the fact that they don't like their smile, it may be holding them back?
It's definitely
the case. Or they're
the
ashamed
case.
of their smile.
And many of these people have not liked their smile for decades. And I'm trying to give them permission to change the smile and the way they feel about themselves, because there are thousands and thousands of people that have been through the same experience, and having gone through this process, having gone through this treatment, has changed their lives for the better, and that is the addictive part of it.
Okay, so back to the original question. I mean, who is your typical patient? What type of patients do you see?
We see a wide range. We see anything from teens all the way up to 90 years old.
90?
And beyond, actually.
Okay.
You'd be amazed. A wide range of people. Probably our most typical patient that really has become most fulfilling for us are those persons in the middle-age years that have had difficulties with their teeth for a long, long time, and for various reasons, good reasons a lot of times, they've not been able to address their mouth and their health, competing priorities, and they finally kind of back up against the wall situation. They're in a transition, and those folks are so much fun to serve because we can do so much for them.
Is it because they just don't like going to the dentist? I mean, people still, do you hear that? I don't like going to the dentist, doctor.
Yes.
I mean, how do they say it? What do they say?
That's exactly what they say. In fact,
Really?
sometimes they're even more blunt. They'll say, I hate the dentist. And
They say no offense? I mean,
no offense, unfortunately.
That's funny.
But they will say that. In fact, a recent study done not long ago indicated the number one reason that people avoided going to the dentist was the fear of needles. The fear of needles, that was the number one thing. Now, I have to tell you, many, many years ago, a mentor of mine that was a very respected dentist in those days taught me a technique for giving virtually painless injections. And after 20 years of practice, I have to tell you, Randy, in fact, we try it sometime if you want me to prove it, I give excellent, painless injections. Every day in our office, somebody makes that comment. They're just amazed. They didn't feel it.
What do they say?
They'll say, are you done?
Now, we were talking, 3 years ago, was the last time I interviewed you, and you said a lot has changed. I mean,
even in 3
how
years.
so? How so?
Well, specifically, there's new technology for taking better images prior to the procedure. It's called an iCat. It's 3D cone beam technology.
In your office?
In the office. So they don't have to go anywhere else, which, of course, the first benefit is it saves time. It makes our procedures quicker,
Nice, okay.
and maybe even more importantly, safer and more predictable. We know exactly what we're doing, what we have to work with. It takes away the guesswork.
When I hear things like nowadays in the right candidate, that it could be almost a bloodless procedure, placing of the implant.
Yes.
Is that right?
It's amazingly
And is that because of the imaging?
That's part of it. It's definitely made it much more safe, much more clean, much more precise. I call it a soft surgical procedure because everything's very clean, very well planned, and very, very predictable. And that's what some of this new technology has brought us.
Okay, the implants, have they gotten better in the last 3 years?
Always changes, amazing changes, not only in their design, but you know what? I can summarize it by saying that when it comes to the technology, the implants, what it has done, it has made things faster. We can get done quicker than we ever could with better results and more predictability. Those are the three benefits that technology has offered us.
Now, why is it that anticipating this interview, I ask around, that what used to take, I guess a year or 9 months, and some guys are still doing it, now can be done in one visit? Is that true? Is that right?
It is true. It is true. Actually, what you're referring to is something that's been used at least 20 years, maybe even longer, and it's called immediate loading. Randy, that's where you put the implant in or implants and you actually put the teeth right on them the very same day. That can be done.
Do you do that?
We do that. We do that frequently. But that can be done in certain cases. So we tailor every case according to the person's own situation.
So when I hear teeth in a day,
yes,
that's true.
It is definitely
with the right
possible.
candidate.
With the right candidate. There's a saying that an idea can be a dangerous thing if it's the only idea that you have. We want to make sure that we apply the right techniques and the right parameters to each case, each individual, and everybody's very different. After doing this for 18 years now, there's so many variables, everybody's goals are different. We make sure that we do the thing that's best for the patient.
Okay, now you brought some photos, and for people just tuning in, we're talking about what you need to know if you're considering dental implants. I want to talk about the categories of patients. I want you to take me through the process, and before we get into those photos, and these photos are dramatic, by the way.
Yes,
I mean, I've never seen mouths like this before.
Yeah. And there's a lot of people in that situation,
really is,
Randy.
without exaggerating. And I think if people are squeamish, some of these they may not want to look at. But the after is phenomenal.
It makes it worth it.
So the categories of patients you see that come in for dental implants, what are they?
Well, we have patients that have just one tooth missing, and we have patients that have several, or people that have no teeth at all. The most common patient, though, that we're seeing are people that have teeth, but they're in trouble. They're having problems. They're either going to lose all of them or a lot of them.
That means their general dentist may have said, hey, or have said that your teeth have to go.
Right, and they're confronted possibly with having to wear dentures or partials, removable devices that are very uncomfortable and very unpleasant to tolerate, especially if you're in your 40s, 50s. We're saying that the new 80s is the 70s, and these people are living vibrant, healthy lives.
They're working on it, right?
They are, and so what we see is a wide group of people, but people that range from just one tooth missing all the way to none, or people confronted with having to lose all their teeth.
Now, would you say that there are thousands and thousands of people in Arizona that are wearing dentures, for example?
Yes, indeed.
That don't have to be.
Yes, and don't want to. Many of them don't want to, and I want to give them permission to not have to. There are alternatives, even if a patient just uses a couple implants, Randy, to snap their denture in place. The difference is dramatic, all the way up to being able to put enough implants in that they don't have to have a denture at all. Changes their lives, changes the way they see themselves and the way the world sees them, Randy.
What about people, and I'm anticipating this interview, that their gums are bad. They're loose, and they say, dental implants probably won't work for me.
Randy, a lot of my patients will come in the office and assume because they have that problem that they cannot have implants. Actually, if the teeth can be saved, we want to help them do that, and there's ways to do that. But when that's not possible, then when those teeth are removed, so is the infection, Randy, and that infection is critical because it has an effect on their medical health. It's been connected to heart disease,
so the gums
strokes.
Get better.
It gets better by removing those teeth. You're removing the source of that infection, and then the implants can restore the teeth without infection, which is very important to their health.
Now IV sedation is new for you.
Yes, that's another big issue. Yes.
How has that changed things for you?
Tremendously, because as I mentioned earlier, the number one thing that people tell us after they've had the care done in their testimonials is they usually start by talking about the fear that prevented them from doing anything. And IV sedation is wonderful for that. It reduces that anxiety, that fear of going through the procedure.
Why is it better than just an oral?
It can be. It depends on the case. We can offer the oral conscious sedation. We would call it the happy pill. That works beautifully sometimes, Randy. Sometimes that's all a person needs. Sometimes we need more control and we need more security, and that's where IV sedation comes in. It's very, very safe. Randy, did you know that 75% of all medical emergencies in the dental office occur because of stress and anxiety? And IV sedation eliminates that, so it's not only just more comfortable for the person to experience it, but it's safer for them.